said, this is great. It's like Donald Rumsfeld as an accidental epidemiologist, and he was quoted, I'm paraphrasing, as, there are known knowns, known unknowns, and unknown unknowns. Maybe this was on missing data or imputation methods or something like that. And so first I will give attribution. I've essentially just lifted this straight from Alan Burkhart's slides. So I'll give credit where credit is due. But I guess the other piece is, even though this is many years ago, I find this just winds up being so relevant to so many things we do, particularly in secondary healthcare research, like over and over and over again. And I really think the perspective to bring into this topic today is, I think the focus is trying to surface things that maybe otherwise you don't know about, and really trying to give people more of a sense of what your unknown unknowns are. I'm sure there will be lots of slides and topics where people say like, oh, this is my area, I already know about this, this is not helpful, but to me, I think this would be really successful if everybody has at least some aspect of this where they were kind of like, oh, I didn't know about this group or this topic. This is helpful tribal knowledge that I wouldn't have otherwise gotten. So just that context of the focus here, I think, is really just getting that glimmer of a sense of your unknown unknowns. And then there are just some hard truths and some disclaimers that I have to give on this topic, and I can explain more. But so, and I guess another piece of context on this is, I think this is true at UNC. I have not spent obviously nearly as much time at other large research universities or AMCs as here. I've talked with people enough and collaborated to the sense that I think this is true everywhere, but it's certainly true here. So the first piece is, what's this? The first piece is that there is no master list. Whatever thing or concept you're trying to think about, like, there is no master list of it. Probably the most common question that and I'm sure other people get it as well, do you just have a list of all of the data sets at UNC? Do you have a list of everybody who does this thing at UNC? Like, no. I think that just by the nature of research universities on the size, the lack of central governance, the dynamic nature of it, like there is no master list. And then kind of segueing into that is documentation. Probably the second most common question is like, well, can you just give me the entire documentation or the entire codebook for this thing? Like sometimes that's possible, particularly on things like prospective data or national research data sets, but especially for secondary data, or sort of more ad hoc data sets, like documentation probably either doesn't exist or it's just not that good. I don't know the number of times that somebody's asked like, well, I don't know what I need from CDWH, but if you could just send me the code book or the data dictionary, I can tell you what I need. Like, it doesn't exist really. So these are two things to keep in mind. I think this really leans into the third part of this. If you don't have a sense that actually finding and sourcing the data for a project and then learning about it is a fairly significant part of your project, I think you're probably underappreciating, part of that work. So, again, this is just from a lot of years of doing this, I would say the perspective that I carry into a lot of this sort of research data landscape. I think to me, I would say this tends to be closer to the rule than the exception. I think the exception is, I know where the data set is exactly. It's really well defined. We have a great, data dictionary for it. And it's really clean and set up. And it's a very insignificant part of the work to source the data, obtain the data, understand the data, et cetera. And so now disclaimers. And I'm going to say this first part of this talk probably just feels like, wow, Peter is super defensive on this topic. It's because I've done this for a lot of years. And I just find a lot of times people are super sensitive about this topic. And you wind up hearing like, well, Peter said your group does this thing and I can get all my resources from it. Or Peter says your group only does this thing and nothing else. I just want to be clear, I'm not saying anything like any of those things. I don't even attempt to say that this list is complete or comprehensive. And then literally as I was walking into the room, I realized I should also probably clarify my focus here is really probably mainly secondary data. Like I touch on clinical trials very briefly, and maybe I touch on things like prospective, national research data sets and things like HCUP or BRICS, very, in a minor way. But my focus here really implicitly is secondary data. So things like EHR data, claims data, other data that's being collected or assembled for, other purposes, and then we're using it for research. This list isn't prescriptive. So I have organized this into categories, but that in no way suggests that the resources that I've attributed this, that this is like the only thing that they do, or that they have agreed to work with you. It was just, I needed to organize things, and this was the way I organize things. And I guess I also have to say, again, to the last piece, I do not speak for any of these groups or make any promises. Again, so the goal here is just to surface information, to identify, those unknown unknowns, and to give people a sense of like, oh, I'm really interested in environmental data. Like, who could I possibly try and learn more about at UNC for these things? The way I kind of think about this is, I get a lot of questions from people about like, hey, I'm trying to do X. Like, who do you know, or what resources are there to do X? This is my attempt to sort of put a lot of that information into a presentation, right? To save that step of coming to talk to me, and then you would just know like, hey, I need to go out and look at the website for quantitative biology because I know they're involved with this kind of thing. So those are all of my disclaimers. I imagine some people might still get grumpy with me, but I've attempted to forestall as much of that as possible. So this was my actual attempt to put a diagram of UNC data resources together. This is like the classic analogy of the major research university or the IMC. Like we are at least 1,000, if not 10,000 flowers blooming simultaneously with virtually no gardening or centralized governance whatsoever. I think this is just how it is. I think this is the nature of large research universities. Again, to that fact of like, you put tons of successful entrepreneurial people together and we're all doing dynamic things, sometimes, in our silo and sometimes successfully crossing out of silos. But, a lot of times you find that flower at the front has no idea that the flower at the back exists, despite the fact they're doing really similar or potentially cooperative, collaborative things. So this was in my actual attempt to start to put together a diagram. I mean, I spent like an hour on this, and then I realized like, oh, I need like so much more real estate to even attempt to do this. This is feeling a little overwhelming. And so I'll admit, I actually kind of, I hate to say I scrapped this, but I certainly changed priorities. I went to more of a text-based, paradigm for this talk. Because this is just, it's so hard to put this together. And, implicitly we know anytime you show both the groups and the direct and the indirect connections, like you're only going to capture part of it. I know this has been attempted before and it's just challenging every time. So I at least wanted to show I made an attempt. I would continue trying to work on this, but it's certainly in no way even as representative as what I have in text today. So, okay. So actually now moving on to thinking about and talking about real resources. And as I said, I tried to break this up into some different categories, some more generalized, some more specific. I will be honest, this gets a little bit sweatier as we get to the end of this, because I realized like, oh, I didn't even talk about this entire group. Like they've got to be in here. So there's probably definitely going to be a little bit more detail and organization in the front. I'll try and make that up by actually talking more about some of these bullets at the end. But so most generalized, just compute infrastructure, right? So for research purposes, where do we go to and who helps with things like just raw compute or building out, maintaining databases, VM access, HPC and cluster, increasingly cloud and generative AI, although to date, neither of those are particularly big at UNC. I think we're attempting to change that pretty actively. But those were certainly much more of like a physical hardware on-prem kind of place historically than cloud. So computing, where do you go to for those kinds of resources? To me, I would say kind of the biggest generalized if you're just at UNC generally. So one is obviously research computing. They are the actual arm of ITS, handles things like secure research workspace, or the actual Slurm-based high-performance clusters like Longleaf, that I'm sure lots of people are familiar with. From my experience, research computing, it can be difficult to move things like tier 3 data into some of those resources. Again, I don't speak for like research computing, but just for instance, like, the data science lab doesn't use Longleaf because it's very challenging for us to move healthcare system EHR data into there. So we use other resources. But generally, research computing is a pretty standard resource for these types of big, high performance computing research needs across the university. ITS is also another resource. So ITS handles lots of things like actual physical servers and hardware, as well as database. So there are people that I know that do their research on databases that are sort of owned and maintained by ITS, so that they don't have to handle all of the software aspects and security of those. And then ITS also has a footprint in cloud. I've talked with them about this. So clearly they have, things like Azure access, and there are some subscriptions. I don't know all of the details of if I am random faculty X and I want to make, an investment in cloud, how that works. But I do know for a fact ITS is involved with it. Like there are folks over there that you can talk to about, things like cloud computing. And then I break out another sort of computing group, which I call resource specific. So this is much more healthcare focused. So from my perspective, so school of medicine has its own ITS group. From my experience, this handles very similar things to ITS, but really just for folks in the school of medicine. So servers, databases, and also cloud. So right now, data science lab is testing out some Azure infrastructure through school of medicine ITS. And then RENC, the Renaissance Computing Initiative, if you're not familiar with it. So RENC is a pretty experienced research computing partner. The data science lab works with RENC for the cluster infrastructure and software stack for our ordered de-identified enclave. So from my experience, RENC is not a place that you go to just generally like, hey, I'm looking for a server. It's more like, hey, I've got this funded project. I have an idea for collaboration that meets both of our needs. Like, could we talk about it? And then same thing with Trax. Trax handles some physical hardware, some software stack stuff, but again, it's much more on a project by project basis. Okay. Moving on to sort of somewhat related area, generalized area of data management. I included this at the last minute because I realized I had not included it, but I mean, this can't be everything that's offered across the university. I'll also admit I'm less familiar with this than lots of other areas. So the first piece is the research data management core. So formerly, this was really a group, a function within the Odum Institute. It was spun out, I believe, around the same time that federal government started having much more significant and explicit requirements on research data storage and archival. I don't actually know the full scope of what the RDMC does. My perception is that they are intended to be a core to really help researchers across the entire university with some of these new and increasing requirements on, like, when you're done with your research, how do you store and archive your data for sharing or for dissemination or simply like long-term archival and availability. But I truly don't know the full scope of their services or their business model or anything. I simply know that they exist sort of in this research data management and data archival area. The other place that I know that really explicitly exists in the area is the CSCC, which is really, as far as I know, pretty much clinical trials focused. Right, so that's like our data coordinating center for folks doing clinical trials to really take over a lot of the data management, data coordination for those clinical trials. And so again, they're offering lots of these sort of data management and research data support areas, but I don't know if they are only limited to trials, but my experience with them is really being pretty much clinical trial focused. I would imagine, I'm sure there are lots of people out there sort of running data management, data archival all on their own, independent faculty or, independent departments and institutes and things like that. I'm really trying to capture like the big institution or school-wide types of things. So I would imagine there are more of these. I imagine some people are doing things like running this either through ITS or through School of Medicine ITS, maybe even research computing handles some amount of like long-term archival. I don't know for sure. But these are the resources that I know of explicitly today. And then this was another piece that I threw in at the last minute because I realized like, oh, I didn't talk about data education at all. And so again, this is probably not even close to fully comprehensive. And this is also very broad, right? So I'm trying to capture, both non-credit courses, seminars, hands-on training, in addition to like actual explicit for-credit coursework, and across all different types of data-related areas. So programming, methods, informatics, all different types of things. For people that don't know them, I think the Odum Institute is always a really good place to know. So Odum Institute is really focused on data and quantitative work, particularly in social sciences. They've been around forever. And I think really largely grew out of, I want to say maybe sociology, but they are a fantastic resource, for things like data and methods consulting. Even I know they do, I believe they do now some training and consulting on things like qualitative data as opposed to purely quantitative. But then they also run things like short courses. They run the Data Matters short courses on things like methods and special topics. And then for those of you familiar with like the data carpentry kind of movement, like coursework, programmatic effort, I believe data carpentry was run through Odum Institute as well. And then I mean, this is such a big topic. I attempted to really try and break it down by actual like school or college. So lots of places in arts and sciences. Quantitative biology in the biology department teaches lots and lots of programming and methodological work in a variety of health and biology related areas. Obviously, Department of Computer Science teaches lots of relevant stuff. STOR, Statistics and Operations Research, teaches lots of stuff. And I think increasingly lots of these departments are teaching not just, inferential statistics, but increasingly, things like machine learning and kind of related, resources like machine learning, like programming languages and things like that. School of Public Health, another big area. So biostats obviously teaches lots and lots of methodological courses. Epidemiology teaches methods courses and also has a couple of kind of database focused courses. Then HPM, Health Policy and Management, School of Public Health, also has a pretty large foot in things like methods courses, as well as data introduction to some kind of big data set and topic areas like claims data, and administrative data, so data sets like HCOP and Haynes, things like that. And then School for Information Library Science, another big footprint in this area, probably maybe even the biggest in terms of things like how do I learn about databases or information storage and retrieval and data management. And then SILS has the CHIP program specifically focused on a lot of these topics in healthcare, where again, a lot of for-credit courses on a lot of these topics are taught. And then I have to mention TRACS. TRACS provides a good amount of education, whether that's through the data science lab or otherwise, on lots of data and related topics. So maybe let me just pause here briefly, because this sort of ends a more generic like overview kind of section of different resources before I move on to much more specific content areas and see, like, are there questions or other thoughts or things like that? Maybe let's just take like 20 seconds before I shift gears.
Peter, this is Juan Ramirez from the School of Data Science and Society. Thank you so much for sharing this. I've dropped some comments in the chat about kind of the categorization ITS. Well, research computing is part of ITS as well, but they kind of have two arms of ITS, research computing led by John McGee, and the cloud operations team led by Ethan Krumhout. And the latter does some work spinning up instances and helping kind of researchers negotiate agreements with the cloud vendors and can help strategize on that. Adding that the libraries does some work on data management as well and data curation. And the third is the work that the School of Data Science and Society is doing around academic, mostly for credit now. We have a BS in data science, Masters of Applied Data Science, which teaches some foundational methods as well as some leadership skills, storytelling, visualization, communications, responsible AI, but also expanding to non-credit bearing in the future. So just adding to the collective knowledge.
Yeah, that is great. Thanks, Juan. I'm glad for all of that, but in particular, I'm glad you brought up libraries because yes, several of the libraries are involved with data and some of these topics. I am not personally familiar with them, but I think it's important to represent them. And I'm also glad that you brought up my really glaring oversight of SDSS because that should definitely be on the that education slide. It's going to show up in some of these other slides, but again, because I was putting the education together literally like right before walking into the room, it just escaped my mind. So I'm glad that you got that on there. That is my fault.
I also wanted to say I put this in the chat as well, and I see you have us here on this slide at the Shep Center. Peter Newman Matthews, by the way. We also do a lot of with the claims data. So we work closely with the HPM folks here. A lot of our fellows are HPM, but we house and offer compute resources for those data as well as other data sets. But you know, we kind of fit in that resource specific bucket that you had with Trax and Renzi, where if you're a funded project looking at health services, we've got a lot for you, and we also try and help out students on and unfunded projects too. But yeah,
I'm really glad that you brought that up because Sheps is sprinkled throughout this, and I really thought about putting them on that resource and compute, and then I was like, I'm going to do that, and Mark Holmes and Brian Cass are going to call me and be like, why are you promising our servers to all these people? So,
yeah,
I'm really glad that somebody else said it and not me. So it's okay. Included, and it saves me from having to defend myself a little bit.
No, yeah, we're happy to tell people we can't help them and you know, everybody can ask, and we may have to say no, but we definitely do have the capacity to help people out, and our anyway.
Great, thank you. Okay, so now moving on to some more specific content areas. This is a topic that I feel like is increasingly coming up more and more often, which is around geographic data, and not just like who has geographic data, but who works with it or like who could collaborate on this. This is everybody that I know of like firsthand. I don't know, in fact, now that I think about it, I'm sure this is not everyone, but these are like major groups that I know of. So Carolina Population Center, which is like, as I understand it, really major research extension of Department of Sociology. So lots and lots of social science focused work happening in Carolina Population Center, and lots of it either geographic based or overlaying geographic data or linking geographic data to it. So really major area. And I guess another piece of this that I should say is, even though I'm calling this geographic data, the other pieces that I'm looping in here are things like census data, population trending data, social determinant of health data. So Carolina Population Center and Department of Sociology are like very major areas from my experience in things like census data, ACS data, social determinants of health, structural racism, indexing, population trends by geographic areas. So really major and active groups with all of those types of work and data. Department of City and Regional Planning and Department of Geography and Environment, very, very active and major in like the GIS and actual geographic data spaces. Maybe even like the most active, like largest amounts of those data and the most people like actively doing technical work in things like GIS and working with shapefiles and like, actually overlaying geography data onto other types of things. I know less about the environment portion of the Department of Geography. I imagine that is environmental data like merged in with the geography, so I can't speak to that piece as much. And then SHEPS actually has a couple of programs that does some amount of geographic work in terms of things like abundance of physicians, like workforce dynamics for the state of North Carolina and some different things like that. The other place that I realized I haven't included is the Institute for Marine Sciences. They work with lots of like coastal and oceanographic types of geographic data. But so, combination of both that sort of population, census, social determinant of health, lots of data, and in just about all of these areas, so even the ones not specifically focused or oriented to health, like even if you just look at the faculty, there are like a large number of faculty in almost every department that are doing things with these data, either directly related to healthcare or really closely directly related to healthcare, right? So like even sociology, city and regional planning, geography, like lots of the research portfolios of faculty in these departments is like health or health related. So, lots of people doing things with lots of these data on things that I think it pays to know about or kind of be aware of. And then similar topic with a slightly different spin of environmental data. Great question. How do I distinguish geographic data from environmental data? I'll be honest, pretty much completely subjective based on my own personal opinion. Here, I am thinking of environmental data as really largely more things like toxins, pollution, heat data, flooding data, right? So more of like physical environment and human impact on physical environment. And again, this is also has been a much more active area of conversation in the past couple of years than I remember it being previously. There's lots and lots and lots of interest in like linking health data to this environmental data and doing projects with them. We're actively engaged in some of these projects right now, as a matter of fact. We have some amount of benefit of where we're located also. So we have the NIEHS right in RTP. They have lots of people that either went to UNC or collaborate with UNC already, as well as the EPA functionally on campus. So we have lots of people really engaged all day, every day in these topics with these data, doing lots of interesting things. And really, a lot of these people were already collaborating with faculty in School of Medicine or in School of Public Health. So, collaborative relationships already sitting out there, but I'm seeing more and more interest in lots of these topics and access to these data. Similar, RENCI has lots of scientists whose research is really focused on either climate or climate and environment, or the interplay between climate and environment and health. That's like a very major area of work for RENCI, and they have lots of grants and sort of federal projects on lots of those topics. And then within the School for Public Health, the most, I'm sure there are many, many groups working on this. The one that I have the most personal knowledge of is the Institute for Environmental Health Solutions. out of the Department of Environmental Sciences and Engineering. That's the group that we're actually working with some environmental and EHR linkages on projects right now. But really, the whole scope of their work is around looking at environmental health in a bunch of specific public health and clinical topic areas. And then Department of Geography and Environment. So again, that's a broad content area department. There's some amount of environmental data in addition to geographic data moving through there, depending on faculty interests and their work scopes and things they're working on. So that's geographic and environmental data. Again, now changing topics to much more directly healthcare related. There's probably some decent amount of knowledge already on like, if I'm looking for healthcare claims data, where do I get access to those, or who has that data? But I include this slide, again, for people who don't know or who don't have a sense, so we can just get some full familiarity. So Shep Center for Health Services Research, very primary place. They are an adjuvant, to HPM in the School for Public Health, in addition to other departments and groups like school of medicine. But Shep probably holds the largest and the largest breadth of claims data at UNC. So including commercial and government claims data sets, BCDS for the state of North Carolina. And Sheps is also who Trax works with when we're doing EHR claims linkage projects typically. So Sheps is, if I don't know, we had a merry-go-round of health claims groups, Sheps would almost certainly be at the center of that merry-go-round. Cypher is another really major group. We'll talk about Cypher again later on in terms of Lineberger. But Cypher is really the group within Lineberger that holds a very special North Carolina-wide claims data set specifically for cancer research. So like they have a very large and fantastic data set specifically in claims data that merged with a couple of other data sets, but really pretty limited to cancer use cases. Lots of individual departments use claims data. I probably have the most experience and familiarity with epidemiology and specifically pharmacoepi. Pharmacoepi does a huge amount of claims work, both with the Shep Center as well as with other groups on claims data. But HPM, Health Policy and Management, does lots of work in claims data as well, especially health services research and health economics. And then, so the healthcare system also has claims data. This is, again, where I say I in no way speak for another organization. I am simply surfacing knowledge. But the healthcare system has claims for things like their ACO population. I don't know that the healthcare system would ever let people use these data sets for research, but they are novel data sets that are technically available, or at least that technically exist at UNC, and that maybe have less visibility than some of these other known about kind of research organizations or research groups. And then on claims data, there are maybe two other specific notes from North Carolina. So for people coming from certain states, you're probably familiar that there are statewide all-payer claims databases. We have no all-payer claims database in North Carolina. The North Carolina Institute of Medicine actually brought this up. It was a task force item in the NCIOM, like, I don't know, it's 2024, like 7 or 8 years ago. But as far as I know, it has never been prioritized or even attempted to get created for the state of North Carolina. So the best you can do, I believe, is to try and string together individual North Carolina level data sets if you're attempting to come to something even close to an all-payer claims database for some group or some geographic area of North Carolina. Now, the possible exception to that would be something like the North Carolina HIE, the Health Information Exchange. So again, depending on what state you're from, you might be familiar with HIEs. If you take somewhere like Indiana, Indiana has like a very long and rich and illustrative history of HIEs, maybe even as like the first or the progenitor of the health information exchange concept. My experience is that North Carolina has a very limited HIE compared to some of these other places. And I believe it's really limited exclusively to things like clinical operational work. So the HIE exists at the state level. Data, from sites goes into it. Under some certain conditions, you can get data out, but I think it's more for like state level needs or for individual clinical needs. I am not aware that the HIE exists to be like, hey, I'm doing this research project. Could I get access to like everybody who looks like this in the HIE? At least I have personally never heard of anybody pursuing that or succeeding with that. So then moving from claims data to transitioning to EHR data, again, I would guess that there is some familiarity with this, but maybe not. And this is a much smaller group than claims data. In part just because accessing EHR data is typically much harder and much more restrictive than accessing things like claims data. And I'm including here a variety of different things that I'm categorizing as EHR data. So both identified and de-identified, as well as multi-site networks. So TRACS is probably, again, to use the merry-go-round analogy, TRACS is probably the center of that merry-go-round. So for research purposes, obviously CDWH EHR data requests come through TRACS, as well as CDRNs and clinical data research networks. So things like the CORNET data network, the STAR data network, those requests all sort of come through TRACS to get reviewed and fulfilled. But also, large multi-site networks, so things like N3C, the National COVID Cohort Collaborative. There are independent faculty that are working with N3C or that have their own data use approved projects with N3C. But a lot of that work, I would say, TRACS is pretty central to. So, for things like localized UNC EHR data research, or lots of these national level multi-site networks, TRACS is very central. I'll put a small plug in for the data science lab. So currently, we are sort of the contact for ORDERED, the OMOP research data registry or repository de-identified. So this is our CDWH data de-identified in a secure enclave. Right now, we are sort of running that platform for people that have interest in pilot projects and accessing EHR, de-identified EHR data directly in a secure enclave. And then obviously the healthcare system is ultimately the creator and the owner of all of the EHR data. And for things like quality improvement and other sort of non-research activities, people will work directly with the healthcare system to access and use those data. Sometimes I get questions about what other EHR data sets are out there? Are there just generally nationally available EHR data sets? As far as I know, that is a very, very, very limited space. The two primary ones that I know of are the MIMIC data sets, which are a collaboration between Beth Israel and the MIT Physiology Lab. They've gone through multiple different versions. They have MIMIC 2, MIMIC 3. I believe now they're on MIMIC 4. That's a data set of totally de-identified EHR records, including waveforms for patients that have been in an ICU during a stay at Beth Israel. That's a very major focus of that data set, since it's at the physiology lab. They're particularly interested in waveform and sensory like sensor processing. UCI Mover is a much newer, smaller data set out of California. That's focused just on patients that have had surgery over a certain period of time. But so both of those, they're technically openly available. You do have to contact the groups, you have to sign data use agreements, but at that point you can access them for your agreed upon usage. So it's a little bit different and lower threshold than say like getting CDWH data. And then other clinical data, this is a really important area. Like there's a lot of other clinical data we could talk about, but the one I'm going to focus on is registries. And I was trying to think about like, how would I define registry? I'm sort of colloquially saying registries here are deep clinical data for specific populations, but really registries are kind of all over the place from my perspective. There are literally, like very small scale localized registries. So, that might be an application, just an epic for your population of interest. I mean, I hate to say it, but I know for a fact that there are going to be people out there, there are physicians or other clinical staff out there that are keeping something that they're thinking of as a registry, like in an Excel spreadsheet on their localized computer, because it's some really important thing, but it is sort of not known about or available to people, right? And so we have lots of these sort of localized UNC specific registries, again, whether they're in Epic or whether they're in a database or whether they're in an Excel spreadsheet. Then we have sort of bigger, more governed, formalized, shared registries. So like two that come to my mind that I know of are cancer survival. That's a registry that we have at UNC, but it feeds into a state level data set. And then mammography, which similarly, that's localized at UNC, but it's formed into more of a statewide network for scanning and looking at surveillance of mammography across the state of North Carolina. And then we have really big nationally organized and standardized registries, right? So these are things like the Society for Thoracic Surgery, the Vascular Quality Initiative, National Surgical Quality Improvement Project, and there are just so many others. A lot of these are created, governed, maintained, and run by things like professional societies in specific content areas. The thing that's great about a lot of these is this is where your deepest clinical content is actually collected in a really discrete way. So like if you look at, I want to say it's, I think it's the STS that runs like the PCI registry. Like that PCI registry, I mean, it has, I want to say it's done by nurse abstraction, but I mean, they have stuff like lesion measurements and diagnostics in there, stuff that's impossible to get anywhere else. The challenge is that, like, as far as I know, there is nobody who has any idea of like, what are all the registries, who are the contacts, what's the data in them, how do you get access to them? From my perspective as like a university, the registries are somewhat ungoverned. Like this is the most tribal of tribal knowledge. You have to know that we do it. You have to know it exists. You have to physically hunt somebody down to figure out where it exists and how to get access to it. So this is a major resource area that I think is still waiting to be somewhat better like organized and tapped as a source for research. Okay, and then another major content area. My sense is at UNC, this is like actually a pretty major focus area and kind of an area of depth is generally what I'm going to call bioinformatics, right? So quantitative work in both genetics and genomics. There are lots of people in this area. So there's the kind of healthcare system spanning to School of Medicine focused program on precision medicine and health. They're, kind of directed by people coming out of the medical genetics group. Like they are very active in using and expanding, both clinical and increasingly informatics and statistical genomics types of activities, moving it into translational research. The Lineberger Bioinformatics Core. I have a whole other slide on Lineberger that we'll get more into, but Lineberger has tons of people doing genetics and genomics. The actual Department of Genetics has obviously tons of faculty doing all kinds of both basic genetic science as well as more of this medically focused genomics and bioinformatics work. The program on quantitative biology. My sense is that while the QBio program is not specifically bioinformatics, they have lots of both faculty and staff and students that is their interest. Like they're there to become a bioinformaticist. Very strong program, lots of people doing stuff there. And I'm sure there are more too. Like I know for a fact there are probably other cores other groups, and other independent faculty that I'm not even thinking of. But these were the ones that came to me totally top of mind. And then very briefly, clinical trials. So again, if I had to pick something like, sort of genetics, genomics, I would say UNC is a really major clinical trials place. Like if I had to pick one thing that we thought about the School of Public Health for, like clinical trials is maybe that thing. The biostats department, like they are a national leader in the space of clinical trials methods, both in traditional clinical trials as well as clinical trial method innovation. So things like smart trials under Michael Kosarak's lab, really, really, really major area of methodological work at UNC in the area of clinical trials. But then additionally, there are just so many resources for supporting clinical trials. And again, this is not really my area, so I'm sure there is lots of other stuff. This is just what I happen to know of. So there's a UNC Office of Clinical Trials for more administrative and governance and sort of resource support. TRACS provides support for clinical trials in a variety of capacities, both administrative and personnel. And then the CSCC, Collaborative Studies Coordinating Center, so actual data coordinating center for actually helping to run the data collection and execution portions of clinical trials. And then a couple content areas that I felt like, I don't know that they fit in categorically with some of these others, but I felt like I get questions about them, and so I should talk about them. So questions about, well, who has unstructured data, or who do I go to collaborate with things like natural language processing? These are the places that I know of kind of working in these areas. So computer science is particularly really deep and focused on methods and methods innovation in this space. I don't know if CS does as much application, like, hey, I'm a physician and I'm interested in applying NLP to this thing. From my experience, CS is much more focused on like, hey, I need to build this brand new novel method to do this type of thing. SILS has multiple people that are involved in NLP at various levels, both in teaching as well as in applying tracks within IDSci and Data Science Lab. There's a variety of text kind of related services and resources, whether that's Immerse or Clark, or now increasingly the Data Science Lab is looking at doing NLP through Azure. School for Data Science, Juan and I have spent a good amount of time talking about shared resources and collaboration on things like NLP through Azure. So School for Data Science and Society, definitely another place where a lot of unstructured work is getting prioritized and happening. And then the other piece is just their independent faculty, like, randomly physicians in the School of Medicine, scientists in the School of Public Health, and SILS, like they're doing this stuff. And we just don't have very tightly knit collaboratives or programs on something like natural language processing or text data. And so we don't know that those people exist, even though they're potentially out there doing great work. So I want to represent that, even though I can't name them specifically. The Lineberger resources that I alluded to. Lineberger is just gigantic and comprehensive. And I would say is basically, capable of doing all of these things that I've talked about pretty much on their own, because they have all of their own resources for doing this stuff. So they have their own bioinformatics core, they have their own data warehousing group. There's the Cypher group housing claims data and working on cancer outcomes. They have their own clinical trials group. For those of you that are not familiar with them, the CHI core exists in Lineberger. That's a group really focused on things like mobile health application development, that I believe also consults on doing things like mHealth development and mHealth application design. And there's just so much more. Lineberger is huge, like it's vertically integrated, it's horizontally integrated, and that all of these different resources, both for basic science as well as translational, for informatics, for genetics, for genomics, like all of this stuff is just, organized under the Lineberger heading. So if you are really cancer related or adjacent, Lineberger is probably the place that you're going to be interested on some level. And then unstructured data, this is maybe the follow-up to the other unstructured data piece of talking about text. So this is talking about images and imaging data. From my experience, UNC is not very deep in what we would think of as like health imaging data analysis, specifically for, I'll say like patient-focused imaging modalities. So this is like, people say, oh, I saw this amazing thing out of Stanford where they're using AI to like read radiology scans. My experience is we do not have as much work and people working in that space at UNC. The thing that we do have is a lot of people working on like digital microscopy analysis. So the Biomedical Research Imaging Center is a huge group on campus, really, working across a breadth of imaging modalities. But from my perspective and from what I've seen, the people that are working on imaging analysis there, it's typically mainly focused on things like microscopy analysis, whether that's basic science or whether that's clinical science. But it's not like, therapeutic imaging modalities. It's typically like microscopy imaging analysis. There are some people in computer science, again, the couple of faculty that I mainly know that are mostly active in this, again, I believe they're pretty much focused on microscopy analysis. Department of Pathology, I know there are people in pathology that are very focused on image analysis. And then I have to say independent faculty, right? So like I know within neurology, there are a couple of people, within radiology, there are a couple of people. But again, we just don't have, I would say, a very strong like healthcare imaging analysis focused program at UNC today. And so it's sort of scattered between some groups and between some random faculty here and there. And then another big, increasingly dominating focus area is generative AI and large language models. So, maybe people know this. I don't know how much visibility people have on this space. And truly, the space is changing almost every day. So computer science, very, very active in this space. School for Data Science and Society, very active. Data Science Lab, we are, really trying to build out services and research collaboration areas in these spaces, really specifically focused on applications in translational healthcare research. But I mean, just based on the communication from the provost's office this past week, I mean, I have to ask, I mean, maybe just the entire university is now pretty focused on this. I'm not sure. Certainly, it seems like lots and lots of people are focused on this. I don't have a very good idea of who is doing this work, who is far along, who is just beginning. I will say, now that I'm thinking of it, actually, Renzi does quite a bit of work in this space. I've met a couple of random graduate students and faculty members that are sort of working in this area, but again, like not a whole programmatic area. Patient-reported outcomes. I'm sure we have more groups involved in this actively from a research perspective, but if you don't know about them, UNC has like one of the stronger quantitative psychology programs in the country. So people, specifically training and teaching just on quantitative psychology and things like scale development and quantitative scale validation. And then Weinberger has its own patient-reported outcomes core. Devices in engineering. I'm sure that there are more groups involved in devices in engineering. The primary one that I know of is really biomedical engineering. Tying to that, there are certainly groups at NC State that we collaborate with and have relationships with, but I'm less familiar with them. So, if anybody knows of other groups or, big areas working in devices and engineering, I'd love to hear about it. And then I have to say, it's just sort of like a warning, again, because this comes up multiple times, like, what are the hardest things today? Like, I know from specific conversations, like if you are trying to do one of these things, it's just going to be hard for you. Sensor and waveform data, we just don't, even though we technically have like petabytes of it from the healthcare system, it's really hard to access. Like we've looked at a couple of projects actively trying to access it. It's really hard to get to. And so if like you're a sensor and a waveform analysis person, of which I don't even know of many, if any, really doing this seriously at UNC, like it's hard. That has been challenging. Imaging data, also really challenging. Again, I'm sure we have like petabytes of imaging data in the healthcare system, but it's hard to access. It's hard to manage, and it's hard to get the resources to analyze it. It is a challenging area compared to some of these other content areas. And I have an asterisk by it because that doesn't mean it's impossible. It just, on the scale of things, it's easy to hard. It is going to be one of the things that is harder. So device data. This is a little bit of a mixed bag because I know there are going to be people that say like, hey, I run this registry just of like these devices that we implant, right? So especially in things like cardiovascular areas, like I'm sure any, like LVAD that's going in, or probably lots of other heart-focused device, we probably maintain a specific registry of that thing. And it's technically possible to get a bunch of information about it. But if you are a person that's more like, you know what, I'm really interested in looking at device epidemiology of all of our like peripheral stenting hardware, or even all of our cardiac stenting hardware, my experience is it is overwhelmingly difficult to get that data because it lives in like healthcare system inventory systems or in total free text in completely unstandardized ways. And so, thinking about it from something like a device epidemiology perspective, my experience has been very challenging to get what I would call like good, clean, comprehensive device data across lots of different content areas. Another really challenging area is just data outside of the EHR. And so the specific areas that I'm thinking of are, I've talked with people where, they're interested in like, I would like to get the information from an ambulance as the patient is coming to the medical center, or I want to get information like from the air ambulance, like technically possible, but my experience has been really hard. So again, just these caveats of, if your particular interest in focus area falls into one of these places, like you're going to have maybe not a bad time, but certainly a harder time for sure. And then other things that I did not talk about, but I have to at least mention because they should be represented. I'm sure I'm missing other things here, but the dental school, I'm sure the dental school is doing a million things and I just don't have firsthand knowledge of them. The pharmacy school, same thing, nursing school. And then, there are lots of great, interesting programs that are not represented here, right? So like I have firsthand experience with the injury programs, part of which is in epidemiology, and another part is run through the Department of Emergency Medicine. Like there are great programs doing great work with access to interesting and novel data sets. And again, like it's just harder to surface some of these things. So, this is my attempt to say, even if you have not been included in this, it's probably just a representation of my limited perspective as opposed to a statement on what you're doing or anything else. Okay, and let me just end there. I know we've gone very quickly through a lot of different content areas at a very high level, and we are really just at time right now. So let me pause, see, what other additions people have, what questions anybody has, or just, any other thoughts that people have on this topic. Yeah, go ahead.
So this is Matthew Egbert in the Department of Peds and School of Medicine. This was really great, and I certainly can understand the hesitancy of saying this is, near complete, just knowing myself how many data sets I've tried to learn about and understand just how broad the landscape is. But on a somewhat related note, especially with folks on the call from some of these schools, is there any thought to or opinions on, not just the access to the data itself, but, as many schools and departments, the education, there's a lot of overlap in terms of some of the courses, whether you're taking it for credit or audit. I'm just curious, as someone who's trying to learn this stuff, is there consideration for just how much, like, you can take like 4 different classes all on the same topic? It can get really, I can get very flustered thinking, well, which one do I want to take? I don't know if there's any discussion about that. I know I brought it up last time about the education piece, but
Yeah, I mean, I'm happy to give my perspective, but I would invite, perspective from others. I don't know if this is better organized other places, but today I don't feel like it's particularly well organized at UNC. I've actually talked about this just from, say, like a basic data science programming perspective with 1 or 2 people recently, right? So if you just take a topic like, well, we have a need to teach people R or Python, who is doing that today? And who should be doing it? And how do you organize it? And is it being taught in a department that is really limited to just that department students? Does it need to be a big 300-person class for everybody at the university? And I mean, we don't even, I mean, this is just me and the 2 or 3 other people talking. We don't even know the answer to the first question. Like, well, who is teaching this today? Let alone an answer to the second question. Like, how should we be organizing it? And so I do think it's, from a curriculum standpoint, I think it's really challenging. I mean, if I were the university, my answer might be the School for Data Science and Society is intended to be the place to sort of centralize a lot of this. But practically, I think we know a lot of departments and other schools kind of don't fall in line with that. Like, we still have lots of different related topics being taught formally and informally in a lot of other places for a variety of reasons. Yeah, I mean, I don't know how we sort of improve that situation, whether it's top down or bottom up. But I would love to get other perspectives on either the nature of that problem or possible solutions to that problem.
I'm Rachel, sorry, I'm a faculty member in psychiatry. And I just added this into the chat, but there's a new, also like the TIS lab, the Translational and Information Sciences, I think, lab, joined like UNC just this summer in genetics. And I'm not volunteering them to like do any work, but they're a great resource. Like 2 of the faculty, I think, are in this school of the data science, so the data science group, and like they do a ton of work with the giant COVID, national COVID lab research that happened. So like they're a good resource in terms of just like reaching out and saying, do you know who knows about this, or where I could find more information about this in terms of a lot of different methods. Like they have worked with how to translate imaging data into like an EHR, for example. And they have a lot of people all over the country who kind of know about this stuff. So they're a great resource. And then if you're interested in all payer claims, the all payer claims data council like keeps track of them across the country. And a lot of states let you access their claims, all payer claims data through, like, you may need to pay for it, but they are accessible. And like Colorado's, someone asked about linked data, like you can get a version that has some linked EHR data. So like, I realize that's not UNC specific, but the All of Us data also, I believe, does have EHR data attached to it to some extent. That's like a national NIH database, and the TIS lab, I think, is involved in some of that. So like, I think it's definitely complicated to get access to, but those are some newer people, I think, at UNC that might have some insight into those versions of data.
Yeah, I guess I should add for clarification, Melissa Handel's lab, which is the TIS lab. So we've worked with them for several years on N3C as close collaborators. And it's actually Sean O'Neill, the primary education person in Melissa's lab, that I have been talking about on these issues. Because he is particularly interested in teaching things like introductory programming courses. And so Sean has actually been a primary person that I've been talking about, like, how do you organize these courses and who is teaching them? But Melissa's lab is very involved with tracks and to some degree with the data science lab as well.
Got a question in the chat.
Okay.
When and how can different sources of healthcare data be linked? For example, how can EHR data be linked to claims data or other sources?
Yeah, so data linkage is a can I call it a hot topic? It's increasingly a pretty pervasive topic, across a variety of areas. So Trax and Sheps have worked on claims linkage for a number of years. Trax has really done linkage between EHR data to a variety of kind of more geographic or census data for a number of years. So things like the ACS and kind of other census-based social determinants of health data. And right now, the data science lab is working on fairly large scale, like North Carolina-wide, environmental data linkages for water use, heavy metal exposures, and then heat. But I feel like the question might be more about like the methodological approach. And I think the answer to that is sort of just it depends. It depends on the details of the project, and it depends on the data and whether it's identified or whether it's de-identified. A lot of linkages wind up doing probabilistic linkages, which we have experience with, which Sheps has experience with, which lots of people. Cypher does probabilistic linkage, Epi does probabilistic linkage. Or, in fully identified, where, you have potentially like matching deterministic keys between data sets. Sometimes that linkage is more straightforward. I've seen or heard of, a very small number of use cases where people have actually brought in things like consumer data to link to patient data, where you're linking more like at the actual street level address or even at like a social security number, something like that level. So methodologically, the linkage approach can vary, but hopefully that gives at least some sense of both like the linkage breadth or availability, as well as kind of like some thought on how we think about actually doing the linkage itself.
And they might also be asking about like which of the different groups you've talked about do data linkage work.
Yeah, so I think for that, it mainly, so in thinking about what groups actually work on or perform data linkages, I think that's probably largely driven by who is sort of the content owner of the data itself. So for instance, like if you were looking to link data to the EHR, pretty much typically that's always going to be managed through Trax, since we are sort of the stewards of at least the UNC EHR data. And then if it's to something like claims, typically we'd be working with Sheps. So currently we're working with, the School of Public Health Institute for Environmental Health Solutions is the sort of the environmental data. So I don't know that I can give you like a comprehensive list service-wise in terms of like, if you were looking to do linkage, you should talk to group X because they provide linkage as a service. I think it's more, you should go to the groups that own and are the stewards of the data, and then work with them to figure out what the use case is. And if you need to do linkage, like how would you actually get that linkage done, whether it's within that group or whether it's collaborating with some other groups.
No more questions in chat.
Any other questions on the chat, on Zoom? Anybody?
Hey, this is Heather Henderson. I put something in the chat. I just wanted to mention the CFAR, the Centers for AIDS Research. If you mentioned it, I missed it, I'm sorry, but they have almost 30 years of longitudinal data for HIV patients, including patient-reported outcomes, and also a lot of support for research. So I just wanted to make sure that got mentioned.
Yeah, so Heather, I'm glad you brought that up. I actually thought about infectious disease, and because it's not my work area, I really don't know the groups or like the data sets. Are there other groups kind of focused on infectious disease and kind of related topics that like we should know about? I guess, and as precursor to that, I should say that hospital epidemiology in the medical center is very actively involved within the healthcare system on like active surveillance and infectious disease epidemiology data, as well as facilitating research with that data using, you know, like the localized collected data that they have. I wanted to at least make that visible, even though I didn't include it in the presentation. But I mean, Heather, are there other groups that you could think of that people should know about from like an infectious disease standpoint?
I'm not really familiar with another group. I know people who have their own data sources that have been curated for various things, but they're so scattered. I wouldn't even be able to give you names right off.
Yeah, yeah. I sort of chalk that up to that independent faculty category.
Right.
Yeah. Great, thank you. All right, well, thank you everybody for your time. I hope that, again, at a minimum, that maybe this gave you some thoughts or perspectives on some areas that maybe you didn't know about beforehand, or maybe some other groups to think about or contact. So currently our plan is to have our next Data Science Lab seminar, third Tuesday of October, on the topic of really methodological approaches for balancing cohorting data with a variety of matching and balancing methodological approaches that Thomas McEntee will be giving. All right, thank you all for your time.